Back there's a local program called Reach Out and Read that's helping diminish the local and national issue of illiteracy among children under 5. We're talking with Dr. Marcia Spitzer this morning about the organization and how important it is to read. Good morning.
Good morning.
So why is it so important for kids to read at an early age?
Well, it's important for kids to be exposed to books at an early age because we know that the more children see books, the more they enjoy and share books with their parents, the sooner they pick up words, the larger their vocabularies are, and the more ready they are for school when they hit kindergarten.
Yeah, and that can be sort of the launching pad for their entire education, right?
Exactly, correct.
And I have this cute book here, The Very Hungry Caterpillar, Eric Carle, one of my favorites. You know, a lot of us grew up with our parents reading to us, and so it's just what parents do. We do what our parents did, but for some people, their parents didn't read to them. So how does your organization help parents and kids connect and start that process in their family?
Oh, that's a great question. So the Reach Out and Read is a national program. Here in San Diego, we're sponsored by the local chapter of the American Academy of Pediatrics. And what the program is it's 3 parts. It was started by some pediatricians who realized that there were books that they would put out in their waiting room. This is out in Boston. They put used books in the waiting room, and those books would disappear day after day.
Wow.
And instead of being upset and saying, well, who's taking our books, they embraced it and said, wow, this is an opportunity for us to promote literacy within the healthcare setting. So there's 3 parts to the program. The first part is that all of our sites have used books in our waiting rooms. Where I work at Family Health Centers in San Diego, we have a bookshelf, and I could stock that bookshelf probably twice a day. We put out used books that we get donations from people, from libraries, from a variety of sources. The second part is once a child comes into the exam room, when they're there for a well-child visit between 6 months and 5 years, and there's 10 of those visits over those 5 years, they get a brand new beautiful book like one of these. This is one of the books that we would give to a 6-month-old because it's just got beautiful pictures of babies with their parents. These are the kinds of things babies love to see.
Yeah, they do.
They're simple. There's just a few words on each page. Some pages don't even need words. Parents can talk about this book. They can point to things. Children can pick up this book. They can put it in their mouth. All sorts of things they can do. And then the third part is that the pediatrician, much like I was just talking about how to use the book, the pediatrician will talk to them about, well, how can you incorporate books into your everyday life? We talk about reading as part of a bedtime routine. We talk about reading as just a good bonding experience.
Yeah, it really is. I mean, along with the education, it is a moment for you and your child to exhale for a little bit and settle in, and you kind of create that relationship where you open some conversation too. I know you've been doing this for years, so there has to be some great numbers on why this is so important. It's not just, oh, this is great, you should do it. There really are some amazing advantages to kids who get an early start reading.
No, that's very true. So Reach Out and Read, because it's been around for over 20 years, there's been an opportunity to do a lot of studies on what happens in sites where children are exposed to the Reach Out and Read model versus children who are not. And children who have been in a clinic where they do Reach Out and Read, when they start preschool at age 3, age 4, are 3 to 6 months more advanced in their literacy skills than children who are not exposed to the Reach Out and Read program. That's a big difference. When you're only 4 years old, 3 to 6 months of your life is 20%, 15% of your life.
Yeah, and they start looking at children in those classes to see, well, who can move over to this area, who can move to there, and sometimes you've got mixed classes where kids who are advanced move up quicker, so just sort of gives them that great jump start. You've got an event going on.
Right.
Yeah, tell us about that.
It's called the Read and Romp. It's our annual event. It's a fundraiser, and it's also just an opportunity to express our love for early literacy. It's going to be at Liberty Station in Point Loma on the 22nd of March, and it's a morning event, and it's around different literacy activities for kids. So for example, we're going to have One Fish, Two Fish, a great Dr. Seuss classic, and kids are going to have the little magnetic fishing poles so they can go fishing for fish. We're going to have Knuffle Bunny, which is a great book, and kids are going to be able to make their own sock puppets. We're going to have people from the YMCA doing exercise activities, dancers, and a whole host of just fun events kind of based around some of these books.
Very interactive.
Exactly.
Kids excited. Give us a website so people can get some more information.
Sure. It's www.rorsd.org.
Fantastic. Marcia, thank you so much.
Thank you for having me.
Thanks for coming in.